Dr. Ghatan, there's a lots of talk about loss of collagen and how that affects our good looks. What do you have to say about that? And how can it be revibrated or put back into the body with a vitamin pill or whatever the heck?
Well, loss of collagen is a fact of life, and there is always collagen remodeling. There are some topical creams that suggest that they can improve and help with the collagen production, but that's something to be seen, I would say. The most effective treatment would be laser treatment, which we know clinically, we've done the test and we've seen it. It causes collagen reproduction, collagen remodeling, and that helps. The other way to do it is to use the fillers, such as Restylane Radius and etc. There are so many of them now, and just to fill in that gap, that loss, and improve the looks.
I see. Okay, and so again, so you do the fillers and you do the laser, and so the person comes out looking fresh and alive again. The skin looks live. On an average, how long does that type of treatment last, whether it's a filler or the combination of it? 6 months, 8 months, 2 years? And can it be redone after it has lost its effectiveness?
Sure. The treatment, the fillers, there are different kinds. They can average anywhere from 6 to 12 months, sometimes 1 or 2, about 2 years or so. Or there are some fillers that may be permanent, such as silicone, which I would not advise too commonly for people, because there are problems with that in the long run. It can be done again, and people do come back because they've seen the results and they love it and they get used to it, and so they come back. We do tell them you need to come back in 6 months or a year to do more treatment, and it's done. Sure.
Beautiful. Okay. Wonderful. By the way, what's the the major disadvantage of using a filler which lasts, so to say, forever?
The disadvantage, I would say, is that as we age, different parts of the body aging, say on the face,
right.
And, you have corrected one problem, say with silicone, and the other parts of the body you haven't touched. And those areas are going to change, and this area that was fixed before, suppose, quote unquote, is going to stand out. Yeah, and it's going to be an uneven look, right, and distorted figure. So that's one of the main things that I do have against having permanent fillers.
Well, I can see why. I mean, you put something in, it fits now, but let's just say 15 years later, or maybe faster, as we, let's just say a person is 50 now, and then at 60 and 65, let's just say he overall loses, gets thinner because his whole body gets thinner, and there's nothing he can do about it, and then you have that filler sticking out, like, it doesn't get thinner, you know what I mean? So it doesn't fit the rest of the face. That looks like a big problem to me. Thanks for letting us know about it, Dr. Ghatan. Appreciate it.